Just 1 month ago, Los Angeles County dropped nearly all COVID-19 restrictions as it celebrated the reopening. Well, this weekend, that same county reinstated its indoor mask mandate, facing now that dangerous Delta variant and a rapid rise in cases. Let's bring in now the CEO of MLK Community Healthcare and Hospital in South Los Angeles, Dr. Elaine Batchlor. Dr. Batchlor, thank you for coming back, spending some time with us here on GMA3. Tell me, first of all, give us an idea, some perspective, what you're seeing there now compared to what you were seeing about a month ago that now has you so concerned.
Thank you for having me. So we are seeing a marked increase in the number of COVID cases coming into the emergency department and being admitted to the hospital.
Is there a difference, I guess? We talk about the number of cases, but are you seeing any difference in terms of a change in the death rate, in terms of the hospitalization rates? Are those numbers staying a little below where they were at one point?
They are a little higher than we were seeing about a month ago, but definitely below what we saw during the winter surge. The patients that are coming in now tend to be a little bit younger and to have a little bit less severe COVID, but it's definitely an increase over a few weeks ago.
How many of the folks you're seeing in the new cases now are among the unvaccinated?
They're almost entirely unvaccinated. COVID now is a preventable condition. Vaccination is very protective. So the people that are getting sick now and coming in are unvaccinated.
Indoor mask mandate going back in place. I assume you think that's a good thing and it can help, but is that necessarily going to do the trick, or more needs to be done? And in particular, we're talking about getting more people vaccinated.
I think it's a good thing that we're going back to a mask mandate so that we can try to slow the spread of this new variant. But it's very important that everyone who is eligible for a vaccine take advantage of it and get vaccinated. We don't want to have the same terrible impact of this disease on the unvaccinated that we saw over the fall. And we do still have people who are not able to be vaccinated, children and immunosuppressed people, and we want to make sure that everyone in the community is protected.
You're seeing an increase as well in the, I guess, the percentage of people, number of folks from the African-American community who are being hospitalized at a higher rate, higher percentage than we were seeing earlier in the pandemic. Is this an issue now of access to the vaccine, or we're still dealing with the issue of vaccine hesitancy and some people still just not ready to get it right now?
I think we're dealing with some of both. I think there's still some of a convenience factor in people not being able to take time off work or being able to get to where vaccines are being offered, which is why we're going into the community and to the places we know are hot spots. But there's still some hesitancy. And I think we're also dealing with a younger group that may think they don't need to be vaccinated. And we want to send out the message that, yes, you do need to get vaccinated.
At this point, we're still sending out message. I know you stay at it, and I know some people talking about we need to go door to door if we have to get people vaccinated. Do you think there's some portion of the population just will never get the vaccine?
I suspect there may be some small percentage of the population that won't do it, but I don't think we're there yet. I think we need to continue to push into the community. I think going to people who have difficulty getting out of their homes is a great idea. And I think we have to keep telling people, yes, you do need the vaccine. You may think you don't because you're young, but even young people can get severe COVID.
And I know maybe some will shake their heads and think, why should we have to incentivize someone to take the vaccine? But look, we've seen all over the country people giving away all kinds of cash and prizes to try to incentivize folks. Are you in favor of doing whatever we got to do, including incentivizing folks with, I guess, those kinds of draws to get them to get vaccinated?
Absolutely. I think we need to do whatever it takes, all sorts of outreach, education, incentives, convenience. Whatever it takes, we need to get as many people as possible vaccinated so that we can end this pandemic.
All right. Well, we appreciate you taking the time. I know it's, like I said to you before we got on here, it's been a busy year and a half for you. So anytime you give to us, we do appreciate it. Dr. Batchlor, we hope to see you down the road, okay?
Thank you. My pleasure.
Again, that's CEO of the MLK Community Healthcare and Hospital, Dr. Elaine Batchlor.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.